Welcome back to my YouTube channel and this playlist on mastering endodontic diagnosis. We covered a lot so far. Check out the entire playlist to see what you have missed. And right now we will jump on periodontal test and special test in endodontics. And after periodicular assessment, we will jump to the periodontal assessment. And there are two types of periodontal assessments. Either you see bleeding and suppuration or suppuration, which will give you some kind of information about the status of the tooth. And the second one is going to be probing depths. If you see a sudden increase in probing depth at certain part of the tooth, it can give you multiple information and take you to a complete different diagnosis with the probing depth. It is critical in early finding of the vertical root fracture. And probing depth is a very important clinic test, but it is often overlooked and underused by clinicians. Perio condition has a broad-based pocket. So if you see a periodontal pocket and you're trying to feel it, then you will see that your probe, once you are walking your probe all around the tooth surface, you will see there is like 1 mm, 2 mm here, but then you are gradually going from 3, 4, 5, 6 mm suddenly, and then you're coming out 4, 3, and then 2 mm all around. That would be a periodontal pocket. But if you see a fast drop of the probe that you are 1, you're 2, 2, 2, 6, 2, 2, 2, that is a typical condition, which is a very narrow pocket. A narrow pocket is something of an endodontic origin. And vertical root fracture is actually something which is mostly from endodontic origin, but more to that later. But that's the importance of periodontal probing. So just add to this your mental checklist that probing is a very important test in coming to the diagnosis for endodontic lesions. And lastly, let's quickly go over some special tests. So there is a sinus tract tracing. If you have practiced some dentistry, you already know you take a gutta percha and you pass it through the abscess. Like if somebody has the patient usually say, I have a pimple on the buccal mucosa of this particular tooth here, and you would see there is a sinus opening right there. You take a gutta percha, like say number 20, 25 cone, and you pass it, you insert it in that opening and you let it go as far as it can go throughout its length. You would see it will just leave the top bit out so that you can grab it. You don't want to lose it in there. And then you take a radiograph, and the radiograph will clearly show the sinus tract because it is actually kind of a straight line. It's a bone. It's not going to go somewhere else. The abscess has made some kind of passage from the bone through the bone opening in the buccal vestibule, and that's where you are trying to find out going backwards that does it trace back to that tooth. So sinus tract is a very commonly used and very important special test for endodontic lesions. Then there is a cavity test, which I already explained that it is done by creating a class 1 cavity only when your other tests are kind of confirming the necrosis of the tooth, but they're not confirmed or not conclusive, and you want to do another test when you want to confirm that it is a necrosed tooth or not. After that comes selective anesthesia. As I said earlier, it is for something when you cannot isolate the tooth. There is so much pain, or it's so hard for the patient to distinguish which of these teeth is the one that is really giving them that symptom or that extreme pain. So you try to selectively anesthetize the distal most tooth and come more and more anterior, or give a block. And if the patient is complaining maxillary and mandibular, that I have pain on both sides, maybe on the maxillary third as well as mandibular third molar, and then you can give an inferior alveolar block. And if the patient pain is gone, that means the pain was coming from mandible. If the pain is still there, as worse as possible, that means it was coming from maxilla. So selective anesthesia is another quick technique how you can find out which is the most offending tooth in difficult or typical cases. So inferior alveolar block to find out the maxillary or mandibular origin of pain, and PDL injection. Start with the most distal tooth and move forward with a PDL injection. Give a PDL injection to each of those teeth. Transillumination is another commonly used method to find out if there's a crack in the tooth. Cracks can be so close to each other that you can barely see them with your eyes or with your loupes. So transillumination help you big time with that. And so does that dyeing technique. So stain or dye can be used, and we often use the methylene blue dye, and you apply that dye on the tooth surface, and you will see wherever there is line of crack passing along, the whole thing would be dyed darker than the rest of the tooth, and that's how you know that there is my crack and I have to treat the cracked tooth now. So what did we learn? We learned there are 4 different types of endodontic tests. There's a pulp test, there's a periradicular test, there is a periodontal test, and there are some special tests. This little group of slides or lectures can give you so many questions in your competitive exam. So I hope that you're going to put quite a good stress on it and make sure that you remember all the critical information that I shared in this video. Let's move to the next part, which is endodontic diagnosis. So now we know about the test, we can talk about the diagnosis, which is the crux of endodontics, which is the most important thing in endodontics. How do you diagnose an endodontic pathology? So this was just another video of the complete endodontic diagnosis series on my YouTube channel. So just go on the playlist section and follow along the entire playlist to master endodontic diagnosis for dentistry exams, which include national boards of USA, Canada, ADC, as well as NEET PG exams. And make sure you post in the comment section below if you have any questions around this topic. Subscribe to my channel, share this video with at least one friend, and I'll see you in the next part of this series.